Hey, I'm Tanner Glass. This is for my CHPM 2605 class. And I'm going to start out by showing my research binder first. My first tab is the vertebral subluxation tab, and I have some research in there for that. I also have my wellness development care tab with some research in there. I have the subluxation condition-based care tab. I have the chiropractic spinal tab. I have the functional neurology and chiropractic tab. And I also have the current mechanic systems tab, the bad medicine tab, the new vitalistic systems tab, and on the last two were the two that we get to pick, and I chose scoliosis and chiropractic for my first one, and on the second one I chose chiropractic and nutrition. So I got some research on that also. Okay, that's my research binder. My next binder is the practice management binder, and I have my pre-visit information in there. Also, I have the visit 1 information, and I have the healthcare class information also right here, and I have the report of findings as well right here, and also my last part of that, I have the progressive report right there. So that is my 2 binders, and I'm now ready for my patient to come in. Today we have Connor here. He's going to be my mock patient. So I'm just going to start out with my introduction, and then we're going to go into the exam. So I'm just pretending like he has just come into the office and he's coming in for his first exam, for his first adjustment today. Hey, I'm Dr. Glass. How are you today?
Good. How are you?
What's your name?
Connor.
Connor. It's very nice to meet you. I'm glad that you came in today. So, what's your reason for coming in today?
I've just lately been having some low back pain.
Okay. Well, we can definitely help you with that. We have a lot of patients that come in with low back pain. So we can definitely help you with that. So I just kind of want to tell you about what a chiropractor actually does. Have you ever been to a chiropractor before?
I've not.
You've never seen one? Okay, so basically a chiropractor treats conditions called vertebral subluxations. Have you ever heard of that term before?
I don't think so.
So vertebral subluxation, you have different bones in your spine that are supposed to move a proper way. And sometimes these bones will get out of line and put pressure on the nerves that run through the spine. So if one of these bones gets out of line, it causes the nervous system to not function correctly. So what we can do as chiropractors is we can push these bones the way they're supposed to be and realign the spine the way that it should be, so that you can have an overall health benefit and have overall health from this. So basically your nervous system controls every function in your body. And if this system isn't functioning properly, then that's what chiropractors can do. They can go in and directly affect the nervous system and bring you back to your optimal health. How does that sound?
Awesome.
Great. So we're going to do a little examination today. So we're going to start out just looking at your health history. So I have in here, you've already read over this introduction tab before you came in. So do you have any questions about that?
No, I don't think so.
So you understood everything in that. So we're going to go ahead and start out looking at your health history. So can you actually tell me, do you take any medications or anything?
No, I do not.
Any supplements, anything like that?
Just a multivitamin.
Multivitamin? Okay. Have you ever had any surgeries or hospitalizations?
Nope.
Okay. What about Do you know your family history? Like your parents and grandparents? And things like that?
My great grandpa on my dad's side has prostate cancer. My grandpa on my mother's side had stomach cancer. And then some high blood pressure in my parents.
Okay, I'm sorry to hear that. Hopefully we can see if any of that kind of stuff is going on with you, and we can hopefully attack that as early as we can and get you to your optimal health so that your body can treat that. Okay? So, what about any type of physical trauma? Have you ever been in a car wreck or like a really bad fall, falling down the stairs?
Nothing really comes to mind.
Nothing that you can think of? Okay. So I want to know more about this low back pain. So when exactly did the pain start?
Around last November.
Okay. Last November. Were you doing anything in particular? Were you...
I was at the gym performing a back squat, and I was coming up from the squat, and I just felt something kind of tweak in my lower back.
Okay, so you were actually working out when this happened. All right. So, is there anything that makes the pain feel better or worse at all? Like resting or...
Rest and ice.
Resting and ice. Good choices. Okay. What about, is there anything at all that makes it worse?
Sitting or standing for long periods of time.
Okay. Sounds good. Okay. Now, I want you to explain to me, what does the pain feel like? If you could describe it in one word, how would you say that the pain feels?
Probably like a dull ache, sort of.
A dull aching pain, okay. Does that pain travel anywhere? Does it shoot up your leg?
Sometimes it'll go down my right leg.
Go down your leg? So you have some we call that radiating pain. Okay. So is it ever constant pain? Just you feel it in that one spot, or is it always kind of radiating?
It's pretty much always radiating.
Always radiating pain. Okay. Could you actually point to me on your back exactly where that spot is? Could you turn a little bit for me?
Right around.
Okay. Good. And I'm going to do more of an evaluation for that later. I just kind of want to know exactly where it is right now. Okay. So, is there a specific time of the day that you feel the pain? Like when you wake up or when you're trying to go to sleep? Or
Usually in the morning it's pretty good, but usually towards the end of the day it starts to really ache.
Okay.
Bad.
Well, that is a lot of information for our case history. Do you have any questions about any of that?
No.
You feel comfortable with everything you told me?
Mm-hmm.
Anything else you'd like to tell me? Okay.
Nope.
So next, in a real office setting, I would actually go on to my physical, chiropractic, and my x-ray exam. But obviously, this is a mock patient, and I'm not fully trained for that. So we're not going to be doing those things in this video. But let's pretend that I went ahead and did my physical exam, chiropractic exam, and possibly sent him out for x-rays if we needed to. And now, I've finished all those exams with my patient, and we're going to look over his report of findings. So, in this folder here, I have your report of findings from all the things that I've found. So, from what I've found so far, it appears that you have some tight hamstring muscles, which is definitely contributing to your low back pain. And I have found 2 subluxations in your lumbar spine, which is your lower back, which is definitely a main factor for this. And I did find also some cervical subluxations. Okay?
Okay.
So, I've already told you what the subluxation is, so you already understand that, so that's great. So, I'm going to show you some stretches also for your hamstrings, but in this video I'm not going to be showing the stretches, but I would teach my patient how to properly do these stretches. Okay, so now I've gone over my report of findings with my patient. And so before we move on to the actual adjustment, I just want to give you the option. Would you like to proceed with my care? You have all the time in the world to think about this. You can come back tomorrow, call me, email me. I'm going to give you the choice now. Would you like to proceed with my care?
Yes, I would.
Okay, that is the right decision. We can definitely get you back to your optimal health. I know that these things are bothering you, and we can definitely take care of that. Okay, so my patients decided to continue care. So I do need to tell you before we move on to the adjustments, there are some possible risks with chiropractic care. Just like any health care, there is some risks. So I have some paperwork for you to fill out and just make sure that you agree. With my care, there is the possibility that there could be certain risk factors, and everything is written on this form here. So if you would, just go ahead and sign that. Or I want you to read it thoroughly first, please.
Okay. Okay.
Okay. Perfect. Okay. And I also want to use this time to tell you about the classes that we have. So let me get to this. This is our healthcare class. So we're not going to be expecting you to come to any of these healthcare classes until later on. And in these classes, basically I'm going to be lecturing and teaching you how, exactly what, I kind of explained to you what a vertebral subluxation is and how chiropractic can help that. But in these, we kind of go more into the anatomy and what's actually happening. That way, when somebody asks you, I'm going to a chiropractor, you don't say, oh, it just feels good. You can actually explain to them why you're going, what kind of things happen when you're there, and then, you can tell them about us. And we can help everybody. We want everybody to have optimal health. That's our goal here. So I just wanted to use this time to kind of tell you about these healthcare classes that we have. So this packet here has all the information. I'm going to send this home with you to read about. Okay. And you can already start reading about chiropractic a little more so you can start getting a better understanding about kind of what you're getting yourself into. But I can guarantee you that that with this care you will certainly benefit and be in better health. So we also do have the advanced healthcare class. Once you've been here for a while and you start understanding things, you can be in our advanced class and really understand chiropractic and even possibly help out with some of our events that we might have.
Okay.
So, do you have any questions about the healthcare class or how to get involved in the chiropractic community?
Nope.
Anything like that? Okay, so we've already gone over your report of findings and everything. So, I've decided, if it's okay with you, we're going to do a lumbar two lumbar adjustments and a cervical adjustment. Is that okay?
Yep.
So at this point, I would be preparing my patient to get ready for its adjustment. So I'd make sure the table was clean and that the patient understands. I would actually explain to my patient exactly how we're going to be setting him up, exactly where I'm going to be touching the patient, how I'm going to be pushing on the patient, and how that's actually going to help him. I'm going to explain to him, you have a vertebrae that's turned this way and this way. So I'm going to try to push it back that way in order to clear the nervous system and allow the body to function to its full potential. So I'm going to make sure the patient understands that, give the patient the best adjustment that I can, answer any further questions that he has, and then I'm going to walk my patient to the front desk and get him ready for his next appointment. Alright, so that does it for a mock visit. I appreciate anybody that watched this video, and I hope I could help somebody out there. Thank you.